are back and into our second hour. And today's Tuesday, so the doctor is here. And he's talking about respiratory diseases. Now, how clear are your lungs, Patrice? Do you feel like you can take a good deep breath and it feels clean?
At any point in time, anywhere, unless places where people might be smoking.
Yeah, that's a good one. And even outside, like the cars, you know, exhausts and all of that. Anyway, so Dr. Senyo is here and he's going to take us through chronic obstructive pulmonary disease and respiratory diseases today. Welcome back, Dr. Senyo.
Thank you very much.
Thanks for
nice
being
to
here
be
this
with you.
Welcome.
Patrice.
I never got my shirt.
It's on the way.
It's on the way.
I want the right size. I want it to
really
fit.
Oh, I'm just like you. I mean, that's the same thing.
Okay.
Right. Respiratory diseases. I'm going to go through what the respiratory system is, and then we'll appreciate disease at every point of the respiratory system.
We're in biology
Right
class.
now, 16th of November, really was the World Chronic Respiratory Disease Day, right? And then it's so important because if you look at the whole world, we have about 235 million people that have been affected with chronic respiratory diseases. And out of those, 90% of the deaths that are associated with these diseases occur in low and middle income countries like us, right? And so that's how important it is. Now, when you breathe in, I mean, I'm sure when you hear respiratory, you know it's about breathing, right? Now, when you breathe in air, what God has done is to make an arrangement along the way or the path where air passes, so that the air will be cleaned and purified, right? Now, the final destination of air is into our lungs, which is in our chest. And the lungs cannot tolerate any, filth or dirt or dust. So when you breathe in air, what happens is that in your nose, there are certain hairs that, trap or filter out, particulate matter like dust and all of that. And now these hairs are embedded in linings which produce a bit of mucus, or what people call phlegms, right? And these also attract, and trap the dust particles and all of that. Now these secretions over there as well have other qualities. They can actually, stop the growth of germs or kill them. Now further down, as you go in, when we breathe air, when we talk, there are certain holes within our skull bones, all right, that are called sinuses. They also condition the air, and the sound that we make when we talk, all right. Now these sinuses as well, within the bones, are also lined by certain linings that produce, fluid and all of that to keep the place moist, and also can trap dirt and germs, right. Further down, when you go into the throat, there's a path for food and path for air. So what God has done again is to put a cover over where air passes, so that when you are eating,
you can breathe.
Good, you can breathe. All right, or you could, so that food does not go to where the air goes to.
Is that what is called the trachea or something?
Well, the trachea is the windpipe.
The windpipe.
We're going to come to that as well. Right now, there's a flap that covers, that side, so that food doesn't get to the airway, right? And then you have the voice box from here, and then the air goes down. Now, all these places are lined by this fine material that produces secretions that are able to trap dirt and all of that. And the hairs that line further down as you go beat upwards, so that what they do is that whatever has been trapped in the phlegms or the fluid or the mucus, is pushed up until you have a sensation here and cough it out.
Wow.
So that's how wonderful God is. And now further on going down, you have the linings with a bit of muscle in them, so that if really bad air is going down, the muscles actually begin to close and close the airway, so that we don't allow too much of the bad air to go in.
That's how you
choke. And then you go into the lungs, where there's a fine network of air pipes that are closely related with blood vessels. Now what happens is that when we take in good air, now the oxygen in the air is able to go through this fine network and enter into the blood vessels. And the blood is able to carry this to all the parts of the body that need the oxygen. And also bad, like waste from the blood is also able to diffuse back into the lungs so that when we breathe, it will come out. Wow. So this is how wonderful our Creator is. Right. Now, sometimes this nice system could go haywire. For instance, people who have like allergies, asthma and all of that, these defense mechanisms are too heightened or they are over-exaggerated. Okay. All right. So that when you are exposed to bad air, let's say cold air, very cold air, or dusty air or something like that, or strong scents. Now, these mechanisms that I've mentioned begin to operate at a much, much higher level. Oh, okay. So your nose begins to get irritated, you produce more secretions, and then further down, the airways actually begin to close and produce thicker mucus or phlegms to be able to trap the bad air. Now, in that case, what your body is doing is to choke you yourself. Wow. Because in an attempt to prevent bad air and all that from going down, it's closing the airway. A bit. All right. So that gives us an idea. Now, also, when we look at this system that we've described, like the nose, the sinuses, the throat, the back of the throat, the windpipe, and all of that, diseases or germs can occupy these places. And when they do, they thrive on the secretions that come there, and then they begin to overgrow and cause disease. So for instance, you hear somebody saying that I've got tonsillitis, or somebody's got tonsillitis. Now, when you open your mouth very wide, you see some two arches at the back. Yeah. Not the one in the middle. The one in the middle is the uvula. Right. Now, the two arches, behind them, you have these, tissues. What they do is to produce good cells that are able to fight some of the germs that get their way into that place, right? Now, these tonsils, that's the work they do, but sometimes they overgrow, get very big, and sometimes infection is able to overwhelm them, and then they get bigger and all of that. So tonsillitis refers to germs affecting that part of the respiratory system. Then you also hear about sinusitis. It just means that there is infection or inflammation in the air spaces that we said occupies the facial bones and the skull bones. All right. Then you also have what we call bronchitis. You realize that the itis joins all the places, right? Now, itis just refers to inflammation. All right. When a place is inflamed, then we add itis. Right. So that's a new term. So cochleaitis will be fair. All right. So you hear about bronchitis as well, right? Then you hear tracheitis, like the trachea. Bronchioles are the pipes going down further. All right. Then further on, you hear about pneumonia. All right. Now, when the lung tissue itself, gets infected, then and becomes solidified by secretions and fluid. All right. And air flow is not able to reach those places. And so it means that this air exchange we talked about, getting oxygen into the blood and taking bad air, which is carbon dioxide, to come outside, does not happen in those places. All right. And sometimes when infection gets to the tissue of the lungs, it can get so overwhelming that they might get access into the blood. Wow. And then this becomes very fatal. All right. So the fatalities are associated with the pneumonias, the asthmas, and the chronic bronchitis, and something we call emphysema. Sometimes the lung tissue itself, or certain parts of the air pipes, begin to lose their elasticity. They are supposed to be a sponge-like tissue in there, right? They begin to lose their elasticity, and some of them break down. So sometimes proper airflow, air is not able to come out as it should. So it gets accumulated within those tissues and then begins to blow up a bit. All right. Now, these are usually associated with, chronic smokers. All right. So the smoking affects, the lining of this fine meshwork. Chronic smokers, Yes. The lining of this fine meshwork. And so the walls begin to get rigid. And then later on, they begin to thin out and then they break out to form bigger spaces which can trap air. Now, there are a few other things apart from smoking. You know, people who work in the mines also get exposed to, you know, dust from heavy metals or other metals, for instance. And so that as well could cause a lot of damage. Inflammation goes on along all the airways that we've described. And then disease begin to form in there. All right. Then people as well, like now we don't have coal mining and all that here, but still in China and all that they do. Now, from mining, we could infer that people who live in very dusty areas. Now, miners are exposed to all these type of dust. All right. Now, we who live in very dusty areas as well are exposed to dust. And of course, we don't know which metals are in that dust.
That's the majority of the country.
Yes. And we also know that there are certain germs that can thrive in dust for a long time. So when we are exposed to all these dust, it poses a lot of risk. All right. Then we also come to, you know, our traffic situation.
Oh, yes.
Right. Now, when you are in, you know, heavy vehicular traffic and all these emissions keep coming out, now they also are not good for the whole respiratory system. Now, the defense mechanism gets overwhelmed when you are sitting in thick fumes. You know, it will do its bit. The asthmatics will get the attacks because of the exaggerated defense. And those who are not allergic or asthmatic, you know, some of the air too will still go in and begin to cause this inflammation that we are talking about. And then the disease blows out.
So, Dr. Senyo, thank you so much for the lengthy explanation.
Right.
How many of these ailments are hereditary and how many are triggered by environmental factors?
Right. Now, a good number, I might not be able to give you the exact figures for the ones that are hereditary.
Okay.
Now, we can just go into them. Now, obviously, there's something that we call family atopy, right? Now, you can inherit being allergic to certain things from, you know, your mother or father, right? Now, some people are born with just a heightened ability to react to certain stimuli, right? Now, if this inheritance is within your respiratory system, then anytime you are exposed to a stimulus, then you will be able to exhibit some of these things, right? Now, over the period as well, anybody who's been exposed to a certain hazard, like we've mentioned, the smoke, the dust, and all of that, over the period, the respiratory tract, as we've outlined, gets exposed to these things, and the inflammatory process goes on bit by bit by bit till it degenerates, and then you have a chronic respiratory disease.
I would like to know something. I mean, there are certain common diseases like asthma and pneumonia.
Yes.
What causes pneumonia?
Right. Pneumonia is caused by, in lay terms, germs.
Okay.
Right. Now, by germs, we mean that you could have bacteria, you could have fungi, you could have viruses, right? Now, or we could also have chemicals causing pneumonia, right? Now, what happens is that when the germs are able to escape the defense mechanisms as we have outlined and are able to get into the tissue of the lungs, then they will be able to proliferate or grow and become a lot and occupy that part of the lung and produce secretions and all that and make the place solid. So that it's no more spongy and able to take in air. And that is what we call pneumonia.
So it doesn't mean you are overexposed to the air conditioner or you are overexposed to air. People think
in a lot of cases, when you are exposed to, for instance, cold air, and you know you begin to produce a lot of secretions by way of defense. And some of these secretions are able to find their way deep down into the lung tissue. Now, germs in the air that you breathe are able to feed on those secretions. All right. So some people can get pneumonia from being exposed to cold air for a long time. Right. Now, recently I read some article that said that most common air conditioners, have been colonized by certain bacteria that could, you know, when they get into your system, cause pneumonia. So you should have your air conditioners, you know, the filters changed or even cleaned regularly. So that could also help. Now we also have chemicals. We have some things we call chemical pneumonia or chemical pneumonitis. Now, when certain people have some chemicals going into their body, either the fumes of chemicals going into their bodies and all that. These fumes begin to cause injury to the linings of the respiratory tract or the lung tissue. And that could also, follow the same sequence, secretions, bacteria, and then full-blown pneumonia. All right.
So like in an environment like ours that we've talked about that is so dusty, I mean, how do you protect yourself? Because you have secondhand smoke where you can do your best to avoid people who smoke or avoid being in areas where there's a lot of smoke. But then with the dust, it's literally everywhere, and you can only dust your house so many times.
Yes, it's a problem, right? That is why most of us are encouraged to keep the vegetation around us. Now that's able to trap a lot of dust. You go to areas where it's dusty just because the vegetation cover is off, basically off, right? And then some of our roads as well that we ply, some of them are not tarred, and then you definitely be exposed to the dust. Now, if you want to be, very health conscious, then probably you need to be walking about with a mask. Now, my mother does that.
Really?
When my air conditioner breaks down and she sits in my car, you see her covering her nose with something. And I'm like, hey, listen, don't let everybody. Well, and that is actually good. Now, if you are allergic to dust, you have, the family allergy thing we talked about, or you're asthmatic, then obviously anything that can precipitate an attack, like we've mentioned, you need to avoid. So if it is dust, then you need to cover up your nose so that at least it will filter whatever you're using, like be it like a mask or something. It will filter the air before it gets to the nose, which would do a bit more filtering before it goes down.
Doc, we'll come back to that one after this break, and then we'll get to know what asthma is, how it can be treated, if it can be treated, and how it can be prevented. We'll be right back after this break. Do stay on.
And we're back. We're talking about respiratory diseases with Dr. Senyo. And before the break, we wanted to talk about asthma. This is a really big issue. I went to school with someone in boarding school, and she died of an asthma attack because, maybe we didn't know what to do in an emergency. Of course, no proximity to somebody to take her to the hospital, all those things. But take us through asthma and what to do when someone is having an asthma attack.
Right. Now, asthma, like we mentioned, it's mostly an inherited disease, right? And it comes about as like a hypersensitivity, of the airways, and which involves, production of, with exposure to the stimulus, be it dust, strong scents, smoke and the like, or cold air. The airways begin to institute the defense mechanisms of producing a lot of secretions. Now in asthma, the secretions are much, much thicker and viscid, like very thick, in an attempt to prevent, bad air from going down, protecting the lower airway. All right. Now, that secretion is so thick that it closes or sits within the windpipes. All right. And also, the muscles around the walls of the airways also begin to contract and close. All right. Now, when that happens, it's basically like your own body is strangling you. So, in a nutshell, that's what an asthma attack is. So you hear them breathing in and out, and you hear wheezes. For instance, if I ask you to blow through this, you hear, when I close it a bit, you begin to hear some hissing sounds, right? So the wheezes just tell you that the airways are closing and the person is virtually forcing to breathe in. All right. Now, that can happen, and not stop. And when it happens and it's not stopping, the person's airways are just closed and they are not even opening at all, we call it a status asthmaticus. All right. So when someone has an acute asthma attack is when these things are happening. And when it stays on for a long time and is not resolving is what we call the status asthmaticus. Right.
Doc,
now,
please hold on 2 seconds. There's somebody on the line for you to ask a question. Akwene, good morning.
Good morning, Patrick and Cookie.
Yeah, good morning.
Thanks for the good work you are doing anyway.
Thank you too.
Thank you.
All right. Please, I want to find out why can I fight Dr. Senyo?
Okay.
All right.
Call after the show.
yeah.
We'll give you his information, okay?
All right. Thank you.
Okay, right. Thank you.
Thank you.
Yeah.
So when someone has an acute asthmatic attack, the person would need to be sent to the hospital. Right. Now, in the hospital, what we do, first of all, is to give you medication that will begin to open the airways. Right. Now, remember that we said the muscles around the airways close. Fortunately, we have medications that can make the muscles relax. All right. And also, and that is what we give. That's what you virtually hear people talking about Ventolin or salbutamol.
The inhalers.
Yes. When that is given by nebulization, where we put a mask on your face and then put some of this salbutamol in a container and then blow air through it. So it aerosols the fluid and goes directly into the airways and it begins to act on the muscles. Right. Now, some of the medications could also be given through the vein. Right. Now, if those are given also, it goes through the blood, finds its way into the lungs and around the airways and begins to open the muscles up. Right. Now, in an acute asthmatic attack, that should be done immediately, right, to save the person. Now, in other instances, when the person has been deprived of air for a long time, you might want to also add oxygen to it so that the person can provide oxygen to the brain especially and the rest of the body. Now, after that, what we also do is to give you medication which will tell your airways to be a bit less sensitive. By that, we mean that when you just walk through a bit of cold air, your body shouldn't overreact because that's not going to kill you. Right. So we give medications that are steroids. Now, these steroids are anti-inflammatory. Okay. Right. So what happens is that they begin to sit on your system and tell your system that, hey, you can only react to a certain level, not above this point to kill the patient. So these steroids can also be given, either through the vein for starters when you come or through tablets. Now, after you've survived the acute attack, we put you on medications that will manage the condition. Right. Now, the two medications that I like to give my patients are these. The two inhalers. There's one that is for emergencies. When at home you have an attack or you begin to feel, a bit of difficulty in breathing over a period. You realize that, no, you can actually hear some wheezes. When you don't have a full-blown attack, it begins to tell you that your airways have started doing something, which can be stopped. Right. Now, when we give you that inhaler, which is usually blue, for an acute attack, when you use it, you use just 2 puffs, it goes into your airways and opens the airways up. You might not have a full-blown attack. It's the same thing you do. We tell you that anytime you're going to do any exercise at all, be it like, partaking in some sports, or you're going to go through some smoky area or some dusty area, you take 2 puffs of the acute attack medication, and then you'll be able to do that. All right. Now, there's another inhaler, which is usually brown, and that has the steroid in it. Now, what I advise my patients to do, usually, is to use that at bedtime. Some people will tell you to use it 3 times a day, depending on how severe your asthma is, and then we'll tail it down. Now, when you use this constantly, what happens is that your airways are controlled not to misbehave, so to speak. All right. So that the interval between your attacks will begin to widen. So anybody that is put on the steroid inhalers will realize that if they were getting 3 attacks of asthma in a week, now they probably be getting 1. And then it goes till some people even forget that, they ever had asthma.
I see.
All right. Now, you don't go home without being also educated about the condition. We need to tell people that, it is not the doing of a spirit. It is not a curse on your family. And asthma is a condition that we said that is in the fabric of your body, the way your body behaves in certain conditions. And when people are made to understand that, they'll be able to comply with the management. All right. So people have asthma, they have medications that can work, and then they decide that, no, I need to drink this concoction. And once I do it, the asthma just is uprooted.
Wow.
It won't happen like that if it is real asthma. But it can be managed so well that nobody will ever know that, yes.
Angela wants to talk to you. Hello, good morning, Angela.
Good morning, Dr.
How are you?
I'm calling from Central Hill.
Good.
I have this problem with this tonsillitis.
Okay.
And for some funny reason, my 2 children also have developed it. And the older one has difficulty breathing. When she sleeps at night, she needs to open her mouth before she can breathe.
And that also triggers the tonsils. So it's like virtually every month the family needs to take augmentin and vitamin C and stuff like that. I want to know if there is something that can be done permanently to help the situation.
Well, you're a very lucky woman. You live at Tantra Hill.
Yeah,
and
Dr. Senyo's clinic is there, so maybe she can...
She's close to me. I'm sure she knows about Tantra Community Clinic.
Okay, so Angela, right? If you're listening, Tantra Community Clinic, do you know the place?
Yes.
Okay, exactly there.
Pop
just
in
go
and see
there.
Dr. Senyo.
Yeah. And just for the benefit of those who heard their question, you know, when you have family atopy or you have a family allergy-related problem, most of the compartments of the airways, you know, overreact, like we mentioned. So it's possible that, you know, the same family will have, you know, hay fever symptoms. The same family will have tonsillitis, same family will have sinusitis, and all of that. And, you know, we call something allergic rhinitis, people who always have like a leaky nose. Now, in the case of children, when the tonsils are inflamed, sometimes they get so enlarged that they occupy where the air has to pass. All right. And also, all this inflammation causes a lot of secretions to be produced. And these secretions, you know, seep down into the throat. And in their sleep, when they are not able to like know and swallow those secretions or cough them out, it becomes a problem. All right. And further on, opening your mouth worsens the problem, but that's what you have to do. Right, that's what you have to do. Because when you open your mouth, the air that's going into your throat is not conditioned. Because it's not passed through the filters of the nose. And then it worsens the secretions and the problem.
Doctor, what's the effect of picking your nose most of the time? Does it expose you?
Right. When you pick your nose, one, you are removing the protective covering that is there, right? And also, there are very flimsy blood vessels just at the, you know, the outer part, you know, the inner outer part of the nose, where we usually pick. And so what you do is that sometimes you might injure those vessels, and then you have some bleeding. But most importantly, the protective mucus that stays there, you know, you remove it. But nonetheless, sometimes you could have very thick and dried up secretions there. What we advise is for you to put a moistened, you know, tissue there. You know, which moistens the place, and then you.
We have some Facebook comments for you as well, Dr. Senyo. You know, Abdul Zakaria says, "I'm not a doctor, but I think smoke and exhaust fumes from firewood plying our road in the name of vehicles has a great effect on our respiratory tract." And Salita says, good morning. She loves to watch this program, but she has to work, so she's missing parts of it. Ephraim says, I have short breath when I exercise, and I tire easily. What should I do to address this problem?
Right. You know, when you have shortness of breath, it could be right from the respiratory system, or it could also be associated with your heart. Right. Now, the common thing when you do a little bit of exercise and you start getting shortness of breath or getting tired easily is anemia. When your blood level is not high enough, what it means is that the oxygen carrying capacity of your blood is low. All right. So although, you know, you are exercising and your body needs, you know, a lot of air and all that, your blood is not able to carry enough. So your respiratory system begins to act, you know, do overwork. You breathe very fast so that you get in enough oxygen to be able to reach the rest of the body. Now, some people also have like heart conditions, and so they might not be able to tolerate exercise. Or some people who have asthma, when they begin to exercise, the stress of the exercise triggers, you know, these systems that we talked about, the overly active defense systems. And so the airways begin to close, and so they cannot tolerate that exercise. Right? So she needs to be seen, I mean, the person will need to be seen by a doctor.
Those of you who are suffering any respiratory problems or issues or illness, make sure that you get to Dr. Senyo so you can understand it. If you have a friend who has asthma, or the person has some tonsillitis, or sinusitis and all the citis.
Someone you know who's always snorting and sniffing and sneezing and...
Just draw the person's attention to this program, and the person could go on further to go see Dr. Senyo. Now we have some insights for you to throw more light into what exactly we are discussing with respect to respiratory disorders. So just take a look.
Within degenerative asthmatic patient. Me pa cho bebre. I didn't start here na me a baby. Me ma me chere say me nya about 2 years. And who say me home no enko yi. Nti e ho na onya woman bi mo chere na bibidru to the started me no na fe de ohun se edro ne me no ma na ma yemre nti me fisa yi amama sa na ma yemre nti eche no ohun se yare no emmabiem to no nim se dro na ageme de me won se me wo ha de no start a me bo wasa na ho me na chi me force nti nya hwe me honya mu nyina ye me boho me joint nyina nti me nyina ho nti nya hwe nti me fe ene me mu no de ade ne hye me mu te se blog me ho me kura no ana se me san soro se ya ti gisi ya rahye me hospital ene me do na mo de we ne kata me hone sa ma me mframa na ne me hu se ekofo kakra na fe me bo wa no na me yi flames no to mo de drobia famintini nim na fe me hu se fe de home no me mu no se na ye no na ba fom kakra afa de no kwa na ekoso 206 ni mu no die me ka se kofom kra na me boa ade ne wa na onje se ade na ye me se me foka na me ko ha ne Kumasi ba da na me dru Kumasi na ye se rush me ko hospital me kwa no so ye ma me we no e kata me hone na che se mframa no ye de ma me de we no wura me search ni me ntini ni mu ye sa so ne ntini ni nyina yira me sa o pressure count na say ehuri ama na kosoro me say free Kumasi ba na anu ya be say last week we be do Friday na me okay afa ekwa nwumre no na home ne nye ne san rush me de me ba doctor ho e wa ha ne be dru ya no ma me drip ne we nti no na je say akwa de say ade no me hu ade ba de me hu ne say me start say me bo wa pa na home no asizi na ma me hu be bia ye me boho me joint nyina de me gina ha kwa me ntimi nyina ho ade ne de me mu sei no me mu ene machi ho no ade ne start ya ho na lock no na lock ene me mfi ha nyina me ntimi nya hwe esa ma me menu nyina ya menyo no me fedro se de kra enko edura me ta no pa ye asthma drain de ene start me tene nka kakra ba na me de ba akwa to menum.
Wow. All right. Yeah. So here's the story. We saw the physicalization of her pain and her difficulty in breathing. We saw the mask that was put on her. So that contains some of the salbutamol that you were talking about earlier to give her some instant relief.
But doc, it's kind of fascinating to see people use the inhaler. The way they hold and press it, it's like something I can buy and use.
Right.
Can I just go ahead and buy it?
Once it's been prescribed by a doctor who's diagnosed your condition.
Right. What if I just want to buy it and use?
Well, if the laws are working, then probably they might not sell it to you because it's a regulated drug. Mind you that it's also got its side effects. Overuse as well is associated with increased and abnormalities in heartbeats and all of that. So people get palpitations, they get anxious and all of that. So some of the patients that you put on the drug might come back telling you, these days I feel a bit edgy and all of that. They might just be using the medication too much. You just need 2 puffs, when you have difficulty in breathing, when it's beginning. Poof, poof. Yes. Or when you're going for her, what we've advised her to do is that anytime, because she goes to Kumasi back and forth, what we've advised her is that at the beginning of the journey, she takes 2 puffs.
Okay.
Right. Now, somewhere in the middle, if she thinks that she's still getting a bit of difficulty in breathing, she'll use it again. Now, there's one thing that I've been trying to sell out to my patients, not in terms of money, right, but in terms of the idea and mentality, right, is this, that there are certain small, devices, right, which you can use to monitor your airflow. The resistance in your airflow. It's just a small device that you blow through. Now, when you blow through it, it tells you how much force you are able to push your air through it, and it records the figure. Now, you can do this every day. Now, anytime you realize that the flow of air is beginning to fall, then you could start using your, acute attack medication, and it works very well. Now, people who've complied have told me that, look, this thing works so well. Sometimes I don't even know that I'm about to have an attack, but the device tells me that, the airflow is getting, restricted, and then you can use it.
Okay.
Right?
Thank you. All right, we'll take a look at the second example we have now.
October 27th. na yare bi kyere me denden ma ye de me ba na me home a na insi so tese me home nyina ate enti na ma meto doctor atwanse na nurse for no efre doctor ti o kire won se de won nso nhwe me mfa ansa na waba enti ancha kura be say 20 minutes time pe na doctor bai no bai no kure ni na eye den enti wo de aduro bi gu bibi mu no wo de share wo de injection bi share me ha ena wo de aduro no so si me hwene ano ti na me home ni nyina so na wo de injection no e wo me nti bra aduro ne san wo we ni mu na fe mitimi hu se me home no ana esi ni nyina no na abrase enti ho na doctor ebisa me se me wo asthma na ena me se mi nimu na de ye me ne de mitimi hu se ebi se ebi wo mi kuro so na se de mi kun eba na eye no no sa na sese no aye me nti doctor check me ye me ribs ni nyina hwe no se emu kwan no aye nketenkete na so ma mi nsuru obetiti ama bibia akọ enti me da for 5 days no na chese mi hu se treatment a omode ma me no na fe ma ye okay enti e wo mu a na me ba check up na we last week na the same thing no esan happen biem eye Saturday twem ni 1 week na me bae enti me bae the same treatment na ye de ma me no eno na omode ma me na na ano den na me bowa me home afi enyeye me bowa ne sa na afi mi ti eni me chika sei nyina eye me ya nti doctor etre drofo from me biem ema treatment affairs na mo de ma me na asa me san course na ne de mitimi hu se ewa ne kofom na se de na me reps no esi choko fa no we de ni nyina ejai
the same.
Yeah,
okay,
right.
so another example of someone who...
you know, for instance, I mean, the case of Madam Gladys, it's you know, sometimes when you've had asthma that is mild, you might not notice that it is asthma, especially when you like quick remedies, like just go around, get something, and then it goes. So she, for instance, knew that the husband had asthma and he gets like very severe attacks, and she follows his management and all that. But she had been getting difficulty in breathing sometimes when she's exposed to certain conditions, but did not realize until she had a full-blown attack and came to us, right? And then, you know, we instituted the emergency management. And the second time she came in, she had a full-blown chest infection. All right, so that had to be treated in addition to the acute asthma.
Is there any way these things can be checked, like to check whether you have symptoms of asthma and pneumonia?
Definitely so. There are certain tests that we do to see whether you are allergic to certain things or you have this hypersensitivity.
Okay.
It could be done right here in Ghana to see if, you know, you could react to some of these stimuli. And also, there are tests to see how your lung functions, which we call lung function tests. All right. Now, those tests will be able to tell the capacity of your lungs, the resistance in the airway, and all of that. So you could just go in. If you think that you've been exposed to dust for a long time, you've been getting recurrent coughs and all of that, you could just go in and have a complete lung, you know, check to see if you have any problems or any shortfalls, or even if you have this family allergy thing, you know. But most of the times, from your own history, you would know that, you know, anytime I'm exposed to this, I begin to sneeze and all of that. That should prompt you to...
Doctor, do you know of any cigarette for asthmatic patients, a special cigarette?
No, sir. Right. What I know is the e-cigarette. Now, sometimes when we are trying to wean people off, you know, tobacco smoke. You know, you give them, you know, what we call the e-cigarette, which is the electronic cigarette. Now, what it is just a device that is shaped like a cigar. And then you put this fluid in it that has the flavor of nicotine, right? So that, you know, when you press a button on it, you're able to, you know, pull a bit of it in, and it produces a nice smoke and gives a person the false sense
Doc, can I have
smoke.
one? I have a special friend that I want to give.
Are you sure it's your friend?
Yes, it's a friend. It's a friend, Doc.
Definitely
We
so.
both have a special friend that I want to give to.
I have a couple. I think I
You
can
do?
give them
We'll
to
pick
you.
it up.
No, but speaking of smoking, now,
Yes.
Adenis wants to know, he said some said cigarette smoke increases the risk of respiratory disease, but Indian hemp helps to decrease it due to its potent composition. It has a curative and cleansing effect. Is it true?
Right. Most of the research that has been done, was done with tobacco smoke. Right. You agree with me that it will be very difficult to do a big study using Indian hemp because it's a restricted, drug. Right. Now, the association with good lung function and all that, I cannot verify. Right. The only thing we know is that if you have the predisposition or this hypersensitivity, then whatever type of smoke that you inhale can trigger a reaction. And Indian hemp smoke is one. So yeah.
Smoking anything, I guess.
Anything at all.
Anything going in there that shouldn't be going in
Even
there.
firewood smoke. Anything at all could cause that. Now I wanted to add this quickly. Now sometimes parents come to you asking if their child has asthma or if you think they could develop asthma. Now it's very important, for the physician to go through the history of the family with them. It's very difficult to be able to diagnose a baby with asthma, especially before 18 months. Now, because we know that there's a common virus that causes a respiratory disease that is a bit similar to, asthma, right? So when they come to you before 18 months, you are a bit careful. You don't want to say that this is asthma. You want to wait to a certain time to be able to say that. Now, the peculiar nature of the airways of children is this I want to explain to you. Now, the distance between the upper airway and the lower airway, which is what is within the chest, is very, 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 very short. Right. And I'm sure you remember when we were talking about children, the previous episodes, we said that because of this short distance from here to here, when children have an upper airway infection, be it tonsillitis, rhinitis, which is like in the nose and all of that, the secretions that form are able to get into the chest quicker. So when bacteria gets in there, it feeds on it and then they quickly have a full-blown pneumonia and all that. So children who have colds and runny nose and all of that are more at risk of getting lower chest infections. And also, there is a connection for everybody between the throat and the middle part of the ear. The ear has 3 compartments. There's one outside here which ends on the eardrum. There's a middle part that has a connection through a tube into the throat. Now, when you have bad throat infection, which is part of the upper airway, the infection is able to track through that tube and go into the middle ear. Right. Now, as we begin to grow, the connection between the throat and the ear begins to elongate and points downwards like this. So it's very difficult for infection to do that. But in children, this connection is like a straight tube. It's short and it's closer to the throat. So when children have throat infection as well, it's able to go into the middle ear and cause full-blown infection. And these need to be noted by most of our physicians so that when someone comes with a common cold or a child comes with a sore throat, all of these things need to be going through your mind. And we want to empower the parents as well to know about these things.
That's fantastic. Right. I mean, for answers to these, I mean, excuse me, all you have to do is to just go to Tantra Hill Clinic and see Dr. Senyo. Seriously. And you can also call the front desk after the show. And we're going to give you his direct line, so at least you can get through to him and solve all your problems with regards to respiratory infections and all.
Doc,
thank you so very much. Thank you so very much. Every Tuesday is a great day for me. I've been writing a poem on Tuesdays.
Oh, really?
Yeah.
You need to recite it.
Yeah, I recite it. One Tuesday I recite it.
Does it have my name in it?
But you're doing something special, aren't you, for patients who are coming
Yes,
in?
definitely so. The last time we spoke about, these sexually transmitted infections, we had a lot of calls, and we love to receive your calls. People wanted to just know where they can have, one-stop package. Now we've devised a package comprehensive package for people who have recurrent pregnancy losses. Sometimes it can be associated with these infections.
Yeah.
We have a package for that. For people who have chronic vaginal discharge, we have a package for that as well. So once you come in, we'll be able to do all of these. So you can keep calling Koku and Patrice.
Yeah,
and
yeah, we'll make sure we get that
Okay.
to you. Thanks so very much.
Thank you,
Doc.
Dr. Senyo.